So after talking about the benign tumors of the auricle, now let's move to the malignant tumors of the auricle. Malignant tumors will include the squamous cell carcinoma, basal cell carcinoma, and melanomas. Squamous cell carcinoma is a malignant carcinoma or malignant tumor of the auricle. Benign are the tumors which are more localized, they do not metastasize, and they can be easily treated by the excision or removal. But the malignant tumors, as compared, they are more rapidly progressing tumors. They can spread or metastasize to different areas. They are not well localized, and treatment is usually more extensive and more hard. So squamous cell carcinoma is one type of the malignant tumor of the auricle. And if you see in this picture, this is the squamous cell carcinoma. More common in males in their 50s who had prolonged exposure to direct sunlight. People usually who stay in the sunlight for longer period of times as a result of some occupation or work, so they are usually more prone to squamous cell carcinoma. Site of predilection, you can see again, mostly the helix is the site for the involvement. We saw in the benign tumors also, and now in the malignant tumors, it's the site of involvement mostly is the helix of the auricle. May present as a painless nodule, no pain present, or maybe an ulcer with raised everted edges and indurated base. So this is maybe as a painless nodule, or it may be as raised everted edges and base is indurated. And this is the picture of the squamous cell carcinoma. Metastasis to regional lymph nodes. So the lymph nodes mostly in the neck and the surrounding regional area, there is metastasis to that area mainly. Fair complexion, people are more prone. White color, fair complex people who are more exposed to sunlight, they are the one who are prone to squamous cell carcinoma of the auricle. Treatment of the squamous cell carcinoma is usually, you can see the removal should be all the margins should be included, and if there is a metastasis, that should be treated also. So excision, small lesion with no nodal metastasis with 1 centimeter of healthy area around it. So if the lesion is small and there is no metastasis to lymph nodes, usually excision is done. But the aim of excision or surgery is to remove 1 centimeter area surrounding the tumor to be on the safe side. Amputation, larger lesion of the pinna, those coming within 1 centimeter of external auditory canal, and if there is metastasis to lymph nodes, often with the en bloc removal of parotid gland and cervical lymph nodes. So amputation is done of the auricle in case if tumor is large, if it is metastasized, and it should be along with parotid gland and the lymph nodes. Next, the basal cell carcinoma, common site, again the helix and the tragus. So common helix, as I mentioned before, the common site for the tumors of the auricle is the helix. Most commonly in men beyond 50 years of age, present as nodule with central crust. You can see this is the nodule with central crust. Any nodule on the helix, on the auricle, should never be taken as light. biopsy should be performed to find out if there is any malignant changes or is any malignant transformation. So as a nodule with the central crust. Removal results in bleeding. Lesion often extends circumferentially into the skin, so as it is carcinoma, metastasis is common, so it can spread circumferentially into the skin in a circumference or in the circle. May penetrate deeper cartilage or bone. Treatment of basal cell superficial lesion not involving cartilage can be treated by radiation or by cosmetic surgery. But the lesions involving cartilage, surgical excision as in case of squamous cell carcinoma. So if the lesion is in the cartilage, usually the tumor is removed along with 1 centimeter area or the surrounding area, healthy area. This is the melanoma, is the brownish blackish color tumor, may occur anywhere over the auricle. More common in men of light complexion who are exposed to sun. So this is the melanoma, more common in light complexion exposed to sun. Metastasis in 16 to 50% of the cases. Treatment is the removal of the melanoma. Melanoma is removed and then skin grafting to create skin flap. And then there is flap used to close the excision on the ear, skin graft incision. So removal of the melanoma along with the skin grafting of the site of the removal. So that was all about the malignant diseases of the auricle, in which we talked about the squamous cell, basal cell, and then the melanoma. Thank you for watching sqadia.com.